Hello and welcome to all of our viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC here for Gold Learning. And I'm very excited to announce that here at Gold, we're working on a brand new lecture pack titled Clinical Support of Infant Sucking Skills. And here with me is one of the speakers for this add-on lecture pack, Sarah Oakley. Welcome, Sarah.
Well, thank you, Kristen, for having me.
It's wonderful to have you here. So before we get started, and we want to talk about the presentation and all that, but first of all, let our viewers know, where in the world are you located?
I'm based in Cambridge, which is in England, in the UK.
And it is March. How is it in Cambridge, England? Is spring coming, or what do you
Yes.
see?
Yeah, definitely spring is coming. It was lovely and sunny this morning. It's actually gone very dull again this afternoon, but it was actually quite warm and sunny this morning. So spring is on its way, and we've got the daffodils out and things.
Oh,
so
beautiful, beautiful. Well, thank you for sharing that with us here. So you are presenting us with us here at Gold for this wonderful lecture pack that is in the work. And I want to know a little bit about yourself. I know you're an IBCLC and tongue-tied practitioner. So tell us a little about your background, your work, and what you're working on now.
Yeah, I started off many years ago, about 30 years ago now, as a nurse, and did lots of nursing roles in hospitals, community settings, primary care with GP practices. Then went into health visiting in 2002 and found that actually health visitors in the UK at that time were very poorly educated on breastfeeding. And I felt that I really was letting these mums down, and went into being a breastfeeding counsellor with the ABM, which is the Association of Breastfeeding Mothers. And then from there did my IBCLC and went into private practice in 2009. Then went into tongue-tie division in 2011. I was lucky enough to train with Mervyn Griffiths and Carolyn Westcott in Southampton. And then my private practice really built up from there. And the focus has been on tongue-tie, which wasn't really my intention. I still obviously do a lot of lactation work, but the demand is for tongue-tie. So my focus is largely on that. So, and I then helped some colleagues set up the Association of Tongue-tie Practitioners in 2012 in the UK. And then I was chair of the ATP from 2016 to 2019. And yeah, I have quite a big practice. I see sort of 25 to 30 families per week. And then I do some training alongside that. I have an online course, which is marketed through Baby M, which is a provider of maternity courses and childcare courses and things in the UK. And I also wrote a book last year called Why Tongue Tie Matters, which is printed by Pinter and Martin.
Wow, you are very busy. You have a lot going
yeah,
on.
Yeah, quite busy.
You have a big practice, and you still had time to write a book and come up with online courses there. Let me ask you about the online course. Is that for who is this course for? Is that for practitioners or parents, of both?
It's for practitioners, and I wrote it originally in 2018. It has been updated a bit, and it's now going through another kind of process of updating, because actually there's been quite a lot of changes in the way we think about tongue ties in the last few years. So what I wrote in 2018 now, I've had to update as we've gone along. But it's not for parents, it is for practitioners, but it's for a broad range of practitioners. So, there's IBCLCs, it's got SERPs, so IBCLCs access it.
Nice,
it's
nice.
also, it's also accessed by midwives, health visitors, nurses. I've had ENT surgeons access it, dentists, body workers, osteopaths, chiropractors, people like that. All sorts of people, maternity nurses, doulas. I wrote it deliberately to be quite broad and appeal to a really wide audience. We've had quite a few NHS trusts in the UK access it for their staff and things. So it's for professionals, but it's for a wide range of professionals, and it's a very kind of broad course that covers a little bit of everything about tongue ties. So hopefully anyone who's coming into contact with families with babies that have got feeding issues will have some insight and some knowledge that they can use to refer them on and get them the help they need.
Beautiful. And you mentioned something very important. Things are changing in the world of tongue tie. It's so much new research out. It feels like, and correct me if I'm wrong, it feels like for this longest time, the subject was kind of, not very talked about, here and there. And then it became there became an interest in the topic, right? And
yes, definitely.
And more education, more research became available. And I think the more we learn, the more we also adapt our practice and what we know, right? So tell me a little bit of what you've seen there in the last few years.
Oh gosh, I think there's been quite a lot of changes in the way we think about it. I mean, when I first trained to do division in 2011, the big thing was posterior tongue ties. There was a lot of kind of reluctance to talk about posterior tongue ties, and we have a problem really, because what is a posterior tongue tie? You know, how do we define it? Different people will define it, you know, in a different way. So, you know, a lot of the literature refers to posterior tongue tie, and they mean a frenulum that's attached more than halfway back along the underside of the tongue. But then, of course, we had, you know, Betty Carolus and Catherine Watson Jenner with their typing system, and actually they came up with the type 4 submucosal tongue tie, which lots of practitioners were saying, well, they're the only true posterior tongue ties, all the others are anterior. And then, of course, with Nikki Mills's research more recently, you know, that's kind of debunked the whole idea of a submucosal tongue tie. And so now we're finding that, you know, having spent years kind of pushing for recognition of posterior tongue tie, we're now having to rethink that whole concept of the submucosal tongue tie, and, you know, view it in a different way, and, you know, reconsider whether division is actually the right thing to do with those babies. And so that's one thing. And I think there's been lots of you know, differing ideas about, you know, why tongue ties reoccur, and that's still something that we don't really fully understand and things. And you know, aftercare is controversial. Everything about tongue tie, there's more questions than answers, I think, still.
Yes, absolutely. You brought it to the point here. There seems to be more questions, and the more we learn, the more questions we have, right? The more new research comes out, or new you know, developments occur. It feels like then we have more questions and more questions. And you're right. There's quite a I wouldn't say, I don't know for a better word, maybe you have a better word for that, but controversy. There's some people who are really into, you know, we need to correct the tie as soon as possible, and others are like, not everything needs to be corrected. And then there is even the technique how to do it, with laser, with scissors, and so on. So it feels like this is a growing, ever-growing field, and it will be quite a while until we really know, and if we ever have a definite answer for everything, right?
Yeah, I don't know that we ever will have a definitive answer. And I think the thing is, the anatomy, you know, the anatomy varies from baby to baby. So, you know, what works with one baby might not work with another, you know. So I think each baby needs to be evaluated on its own merits, really. And you know, put a package of care together for that baby. And I think it does need to be a package. It's not all about a division. And I think, you know, we certainly, I still see parents that have been given the impression that having that frenotomy is going to be the answer to all their prayers and fix the feed. And actually there's often a lot of other issues going on alongside that need to be supported and addressed and worked through, and it's not going to be the instant cure-all that you know, some parents are led to believe it might be.
And we see that again and again, because it's still sometimes sold to parent as the quick fix, you know. I mean, when parents come to us or to the providers with an issue, because they're desperate, right? They are not coming because they feel like, oh, everything is going wonderful. You know, if it was, they weren't coming to us. They wouldn't be issue, there, right? They wouldn't be there. So by the time they get to the practitioner, they're desperate. They want help, and they're so desperate to see an improvement and have, because it's their baby. It's, you know, it's their little one, and they're so hopeful, and they hear about this. Oh, the release, the you know, the frenotomy, and then we're done, and everything is you know, rosy, which isn't often the case. In very few cases it might work like that, but in others don't. So I agree with you that it's very important to have a package that is specifically for this baby, you know, and there's no one fits all, and it has to be really a good plan for each family, what works for each family and for each baby.
Definitely.
Yeah. So let's talk about the presentation here real briefly. This is this tongue tie? How do we decide? And this is the title here for you. So tell us. I know this is a lot to pack into 1 hour, right? Sarah?
It is a lot to pack into 1 hour, and I've just been looking through the slides before we did this interview, and I was thinking, oh, I could have added this in and I could have added that in. You know, every time you write something and you present something, you go back over it and you think, actually, I could have, you know, there's more I could have said. And I don't know that at the end of this people are going to have a definitive answer still on how to decide, but I want people to think, you know, a bit outside the box, that not every tongue restriction is about a restricted lingual frenulum, and that may be part of the issue. That may not be the issue at all. when I was asked to do this presentation, I was a little bit overwhelmed because, you know, I've always listened to people like Alison Hazel-Baker, Catherine Watson-Jenner, the real greats of lactation, about how to assess for tongue tie and how to decide whether a baby's got a tongue tie or not. And I was a little bit kind of, wow, you know, I'm a bit overwhelmed by all this. But I've gone at it from a slightly different angle, I think, and actually looked at, you know, some of the research that's been done with ultrasound and MRI and things, that the function of the tongue and where our focus should be when we're looking at function. You know, what aspects of the tongue function, you know, impact feeding, and then how does that relate to the lingual frenulum and things, but also considering, you know, other structures in the mouth that have an impact on the way the tongue functions. So we're not completely obsessed with the idea that it's, you know, if we cut the frenulum, that's going to be the answer. And you know, what's anatomically normal and what isn't, and trying to tease that out, because I do see a fair number of babies that have got what I would define as an anatomically normal frenulum, but they've got a tongue restriction, and they're the babies that often need things like body work and things and suck training and that kind of thing, rather than a frenotomy.
Well, Sarah, I'm very much looking forward to your presentation. I like what you said about looking at it from a different angle, thinking outside the box. That really speaks to us here at GOLD, so, and to our viewers. So thank you so much for sitting down here with me and talking to me about your amazing work you're doing. And before I let you go, where can our viewers find you if they're interested in the book and in the online course that you have?
My website is the easiest place to go because all the information is on there, and the website is sarahoakleylactation.co.uk. If they just Google my name and tongue tie, it comes up pretty high on Google rankings, so I'm quite easy to find.
Beautiful. Well, thank you so much, Sarah. It was wonderful speaking with you today.
You too. Thank you very much, Kristen. Thank you.
And for our viewers, if you would like to find out more about this presentation and the other presentations in the lecture plaque titled Clinical Support of Infant Sucking Skills, we would like to invite you to go to goldlactation.com and goldlearning.com. Thank you everyone for watching. Bye-bye.